Okay, so the last thing we're going to talk about in this lecture is ethics. Ethics and morals have a lot of overlap. So the very first thing when we're talking about nursing ethics that we need to do is discover what our own values are. What is important to you? What do you think is ethically or morally important? I can tell you that for me, patient autonomy ranks pretty high. I believe in individual autonomy. People have the right to self-determination. They have the right to make decisions about their own care, and that impacts the way I nurse. Okay. So you have to be aware of your own beliefs. Your own beliefs have cultural, personal, and environmental illnesses, and so do your patients. So there are things just in your life that have influenced what you believe. There are cultural influences on those beliefs, and then there are influences, your environment throughout your life that have affected what you believe is important. So first, think about your values. The ANA Code of Ethics is a list of general principles that should be followed, and you need to be familiar with the ANA Code of Ethics. They also provide some specific guidelines for difficult circumstances because ethics is not always black and white. Sometimes there are some conflicting principles. You need to learn the definitions of these specific ethical principles. These are some pretty widely accepted ethical principles. And you need to know what they are because you need to be able to identify them in a situation. So autonomy is the belief that people have the right to self-determination, have the right to determine what happens to their body and their person. Beneficence is the responsibility to do good as a nurse, the responsibility to do good. Non-maleficence is the responsibility to not do harm. That should have another N in it, by the way. It's non-maleficence. So that's a responsibility to not harm. Fidelity is being faithful to honoring your word. If I said I would work on this day, then I'm going to work on this day. Now, part of that agreement to work on this day is going to be, if I'm ill, I'm going to call in. Okay. But fidelity is, I'm going to honor my word. I told my patient I would come back and check on their pain. I come back and check on their pain. Justice is about fairness. It's about making sure that that healthcare is delivered fairly, that we are providing just care to everyone. We're providing everyone with the care that they need. Veracity is being truthful. I don't lie to patients. I don't like being lied to, and I don't lie to patients. Confidentiality is keeping a patient's information confidential. We are privy to a lot of things that people maybe wouldn't want others to know. We don't get to decide what is okay or not okay for other people to know. We need to keep our patients' confidentiality and privacy. And privacy has to do with physical privacy as well as keeping information confidential. So you need to know the definition of those ethical principles. You can look them up in your primary textbook or your transitions textbook, but you need to know them and you need to be able to identify examples of when they're in play. Those ethical principles sometimes are in conflict, and so sometimes we have to prioritize which one is more important. You're going to have an assignment that's going to ask you to prioritize, first identify them and then prioritize them. We prioritize based on our personal beliefs, and often those are personal, spiritual, or religious beliefs. Caring is caring about the patient should be the basis for prioritizing ethical principles in nursing. There are some models that we use for ethical reasoning. You don't necessarily have to know all these definitions, but just so in case you hear the words. Deontological is focused on duty, rules, and moral absolutes. So always follow the rules. Teleological is utilitarian, that which causes a good outcome is good. This is kind of an ends justify the means. Situational, each situation creates its own set of rules and principles, and love is the only norm. So you need to, just if you hear those, understand that those are some models of ethical reasoning. So how do we make a decision about what the most ethical course of action is? There are some models for that as well, and it would be helpful for you to know them. First, assess the situation and identify which ethical principles are in conflict. Consider the possible outcomes of each decision. So consider the actions that might be taken and what the possible outcomes are. And then once a decision is made based on prioritizing those ethical principles, then evaluate the outcome. There's a term called moral distress that you need to be aware of. The nurse knows the right decision to make, but is prevented from doing so due to constraints imposed by others or by the situation. And moral distress is what a lot of nurses are feeling right now, because they know that the care that needs to be given is not possible in a lot of situations because of the pandemic, because of underlying issues with our healthcare system. And so nurses are leaving the profession because they cannot deal with the moral distress of being prevented from doing what they believe to be right. Moral distress can also occur when two or more ethical principles are in conflict. So it may occur when it's really hard to determine what's right because there are different ethical principles. Some controversies, and some of these also came up in some legal controversies. Some of these also are political, and that's because there's a lot of division over what is ethical or moral in these situations. So some controversies that you're probably already aware of: abortion or pregnancy termination, euthanasia, active euthanasia, or giving fetal care, assisted suicide. There's a lot of different pieces of that. And if you notice, most of those surround potentially death and dying. So that's the end of the legal ethical information. You need to understand the terminology and the guidelines and the models that are in this, because when we get into situations, you're going to need to know how to apply those. Okay, see you in class.